challenges this city has faced, and certainly one in no uncertain terms that I think it's safe to say, Henry, is unprecedented. Today, I, as the member of provincial parliament, and my friend Henry Wall here, the president of the Kenora District Services Board, and Barry Baltessen here is the chairman of the Kenora District Services Board, and various other groups have bonded together, particularly over the past week, but certainly for the past couple of months. Things have been escalating in our city, and it's time for us to take some steps forward.
Is the issue, Henry, and bringing more people to, and somehow bring together these 18 or 19 mental health agencies in this community together is not what you do, okay? You do something else. You do the housing piece. This stuff is mental health. Step out of it and let those professionals deal with it, please.
Here. Increase Kenora's capacity and expand its capacity for people and for resources for folks that don't come from our community and the surrounding communities, because we have a disproportionate burden for the size of our city. Everybody knows that.
We understand.
We understand that. We've seen it, and we've seen it long before this 6 months here, in fairness to the great things that the congregation of Knox United Church has attempted to do over the course of decades. We live with it and we see it, and we have no intentions of expanding that. I made that very clear with the Northwest Health Unit today, and I think Wednesday we'll have an opportunity to continue that dialogue. As I said earlier, this is not the solution, and we understand the pressures, and we see it and we feel it in every way, but we think this is an important start.
If I could.
Yeah.
So in part, I think to clarify as well is that what we also need to address in this community is that when we have outside forces looking to prey on our vulnerable, that's in part what's happening here as well. And so there has to be accountability for that. I think as a community, we cannot stand for that, where we have individuals from other communities looking to come here to either bring in drugs, bring in substance, to prey on individuals who are vulnerable. And that's what's happening.
But if you've created this problem, isn't your responsibility to fix it quickly?
The location is the problem. It's the venue. You've built a den of thieves. That's what you've built. Close it. Get rid of it. Morph it into something that is useful, that this community needs, which is a treatment center. We've talked about the model. That could be a home for people, our people who need and would not disrupt the neighborhood, would suit the church's purpose. That's a solution.
We have that coming on board, John, within, as I say, hopefully 15 months. We have part of that solution. I know we don't have 15 months. I understand that. I understand.
You don't understand that.
You
don't
what I'm interested in.
talk about solutions, but you need a solution for the people running businesses downtown. They're frightened of people coming in their doors. It's especially if it is in the winter and it's late. They're frightened.
Guys from DSAB aren't going to do anything about that. They're just going to nod their heads
So
all day.
the closure is temporary, 45 days, or less, yes?
Yeah, 45
And
days.
so what will the people who are living there now be doing over those 45 days? Like if the concern is public safety, then you're taking away the space that exists where those people are now during the height of tourism season, yes?
So this is in part where this is going to happen in 2 weeks' time, and I can tell you as we speak now, staff are working with other agencies and partners in the community to have a temporary solution, so that those who do need it have the supports, and those who don't, who are just here to take advantage of the service and so forth, that they can go back. But we do have a population we also need to look after, and I'm not here to say that we're going to abandon them for the 45 days.
So what, to be clear then, what,
John, there
to
are
be clear, you're
resources
making
and
an
support.
announcement, making an announcement that this is going to be shut down, but you don't have a plan yet for 2 weeks from now when that's going to happen.
Yes,
So why are you announcing this now?
In part, the fact that the number of people that are here today, this is an issue, and you're hearing from your business community. That's why we're moving as fast as we can on this, and that we want to make sure that the residents of this community, that the business of this community, do pay property tax, who do support the work that we do, don't feel abandoned. They don't feel like they're the ones left holding the bag on this.
And John,
Terrific, thanks.
during the past couple of weeks, particularly in the past week, we will be working immediately. Actually, discussions have been underway for contingency plans for the people of this community and surrounding communities who we have managed homelessness for a long time, going back to the time when you were the roving reporter in this city, and we managed it. It wasn't always the best, and we've got some solutions that are coming on board. And to suggest for a moment that there's no plans in place, that's not the kind of people that you're talking to here today. We have been in discussions around working with some of the community groups to ensure that those people have a safe place to be.
So what's the plan?
What prevents the shelter from being shrunk to what it was and going back to the health unit that this was built and that was the temporary facility before Knox opened? Is there anything that prevents that?
For one, it's a privately owned building, so that's in part with the challenge in that.
That's the challenge?
That's right.
So to be clear, in 45 days, you're going to reopen at Knox?
That's the intent,
That's the intent.
What is
That
the
doesn't solve any,
solves
that's
it,
not
solves it.
solve
Your
that.
idea
It's
better.
like probably the poorest.
I think what this is a reset button here. I think all options will ultimately be on
That
the
sounds
table,
good.
but until we have a plan that this community has agreed to, and we think that before the winter comes, we can come up with a solution that the community will be supportive of. We'll go from there. That's as fair as a proposal as we can make today.
Got a
folks.
question from over here.
Well, I
Yes,
just
ma'am.
had my hand up regarding, I didn't hear how you decide who needs the help and how you decide who is not from here,
Yeah.
and who's going to be in those positions to make those judgments and to move people along that don't really need the help. How does that happen?
Yeah, that's the justification for the reset. The
Yeah, and I
problem
like
is, and
that.
it's been widely acknowledged, even by, and it sometimes surprises me that we talk like this, but we have, I have personally done walk-arounds the city and have spoken to people that I've recognized as being homeless over the years. And as Henry said, they're not accessing those services because of this acute, unprecedented problem with this drug and the kinds of people that are coming
So it sounds like
to the
priorities
community.
should be set very quickly, deciding
Yeah.
whom we're going to help and
Yeah.
how we're going to move the others along and how we're going to feel safe in the next
That's
few
that's
months.
exactly what this reset
A
is
plan,
about. A
yeah.
plan.
Plan.
Yeah.
Good.
Sorry if it wasn't framed as
Yeah.
clearly to you, but that's what we're doing.
I have a question. 8 months of the year I live in Victoria, BC. As most of you who read the newspapers know, we've had a really bad time with fentanyl over the last few years. And before that, and we have people that come every fall because we have much better places for them to winter. And actually the city of Victoria is doing a really good job. They've made huge things in the last couple of years.
Yeah.
And are really working very hard, and they're winning the battle.
Yeah.
Have you asked anybody like them, other cities, that has the same problem, how they're dealing with it? And in our case, we're actually, as I say, on the up.
Yeah, best practices are going to be a part of this. There are made in Ontario solutions here. There are examples of speaking with the Northwest Health Unit this morning. There are other cities and towns that we can look at, comparators, to understand what best practices we can implement here. And they move beyond the borders of Ontario, because as we've recognized, there's been populations coming to Kenora from other parts of the country. So yes, they are part of that
We get people
solution.
from Kenora now.
Yeah, that's right.
And if I could, even last week we had a team from Winnipeg here. I mean, the city of Winnipeg is going through similar issues. And so there's a team that came here to talk with staff and with other agencies in terms of what are they doing. Because I can tell you the strategy here is very similar to Winnipeg. Because they're so close to each other, and there's a lot that we can learn from each other in tackling this. So,
Does the city of Kenora have representation on the district service board?
Yes, they do.
Who is it?
Yeah, they have an appointed representative. It's Andrew Poirier. Andrew Poirier.
Yes, John.
I have a comment and a question. You're trying to put a plan together in 2 weeks. You don't make it. The place is shut for 6 weeks. Now it's the middle of September. It's getting cold, and you're going to roll back and say, "Hey, these people have to go somewhere." So what's the criteria for opening this place in 6 weeks' time? There's no criteria.
Well, that's
If
exactly
roll
what
over-
that's
if
why
I
we're
roll
doing
over
this,
in 6
John.
weeks' time, they're going to say it's getting cold outside, but
Yeah.
folks got to live here.
Well, that's one
And
of the
that's
reasons.
kind of a
that-
cop-out to me if that's what's going to happen. So
Yeah.
these people here, in
Yeah.
this group and others, are pretty unhappy
Yeah.
if in 6 weeks' time you say it's whatever, we got to keep it open.
Well, it'd be 8 weeks in total, but in fairness, that's what this reset is all about. I think that's a fair and reasonable amount of time. It also respects the timelines to the colder weather. Single digits become a reality, and obviously we think that between the 2-week runway that we have here, and this is a consensus, we have talked back and forth with OPP, the Northwest Health Unit, the Nietzsche Friendship Center, the Kenora District Services Board. We think this is fair and reasonable as a start, and it's not lost on us the gravity of this situation, but we need to come back with a plan that works, and we think that amount of time will put us in a position to do that. Henry has spoken with leadership and confidence on their ability, and we'll be mobilizing quickly. In fact, tomorrow we're going to debrief on this and get to work on what that 45-day work plan will look like.
So if you can't get a plan together,
We can, and we will, John.
It works for the
We will.
community,
Yeah.
then what happens? We keep it open for the winter?
Well, there's inherent risks here, but for sure. But
What I don't understand, my thing is why do we have to help people be addicts? And that's what we're doing here. We're enabling constantly. We're giving them the needles. We're giving them the cozy bed. We're giving them the food. What we're not doing is giving them help. You know, and I just think that if you're making the choice to get help, then we should offer the help. But if you're not making the choice to make help, no help.
Right.
so
No
we are
help.
fair
We're walking on
enough.
needles. We can't put 2-year-olds down on the harbor front to walk because they're going to get stabbed.
Yeah.
But we're protecting the people that take a bag of needles, take one needle out, inject themselves, and throw the rest away and pass that needle around. And that's not fair. We are all in danger.
Yeah.
Not them.
Fair enough. This plan will have to account for that. I mean, I've sent that message to the Kenora District Services Board. We hear, there's questions and concerns about which organizations are best equipped to deal with these kinds of challenges. We've mobilized to put a facility here in Kenora for Kenora homeless people and treat mental health and addictions. And we have a commitment from the provincial government to bolster financial resources for mental health and addiction in our emergency rooms.
Let's make it easy to get help and not easy to
That
be an
is
addict.
what we're focusing on, but that is not going to come in the next 45 days necessarily. So we want to be able to take some time to get some substantive measures that will